right. Hello. My name is Jessica. I'm a family nurse practitioner. This video is going to be about what is a nurse practitioner. Okay. We'll go through a few points talking about education, the focus of the nurse practitioner, and the setting that a family nurse practitioner will likely work in. As far as education, to be a family nurse practitioner, you have to start out and be a registered nurse, and then you attain a master's or a doctorate level degree as a nurse practitioner, and you take the national exam, either the AANC or AANP. Once you pass it, you become certified as a family nurse practitioner. That's the fast part of it. So the focus of the family nurse practitioner, I'm just speaking to the family nurse practitioner because that is what I am, and there's so many other types of nurse practitioners. You can look them up. Just Google them, you'll find so many different types of nurse practitioners. But as a family nurse practitioner, my focus is in preventative medicine. So I focus in preventative medicine by offering vaccines, by educating about disease processes and the prevention of progression of disease processes. So when I say that, I mean just say, for example, hypertension or high blood pressure as we know it. So we teach about, okay, what numbers have shown by evidence-based medicine, which has been studied to constitute a high blood pressure. And there's different parameters based on other illnesses, but if there's no illnesses present and you just have been diagnosed with high blood pressure, as of right now, the standard is to keep blood pressures less than 140 over 90. Once you go to 140 over 90, depending on what your numbers are looking like, this will tell us if there is stage 1, stage 2 hypertension. And I'm not going to go fully into detail about diagnosis. This is just an example of preventative medicine. So then as family nurse practitioners, I would focus and teach you as a patient how to monitor your blood pressure at home. We'll also monitor it in the office. And we'll implement things like diet and exercise first. If we can get your blood pressure below the standard with diet and exercise, then that's a win, to where we didn't have to implement medication. But if we're not able to, and depending on the level of the blood pressure, if it's extremely high, then there may be, a referral to check on your heart, check on your kidneys, things of that nature. But we do things before that to see if just implementing medication will help while you implement the diet and exercise, because diet and exercise is key to a lot of the illnesses that are preventable, that we suffer with. And so that's kind of how the focus of primary care. So we see, check your annual physicals, everything's looking okay. Then if we do find something that looks to be out of the norm, then that it becomes our focus, and we check on that to make sure, to see if we need to pass this to a specialist, or if it's something that we can do and work together, patient and provider, to decrease the chance that this would progress further or eliminate the illness if possible. So that's really the focus of the family nurse practitioner. And like I said, the services that we normally would offer would be doing the assessments. Of course, we know we do our yearly assessments. We do pap smears for women. We do prostate assessment. Now we're more so focused on doing the blood work of the prostate exam. We check for doing labs. We do vaccines for our little ones. We do vaccines for adults as well, when needed, like your pneumonia vaccines, your shingles vaccines, things of that nature. And these all fall under preventative medicine. So the setting is normally your primary care clinic, or what people like to know it as the doctor's office. But you may not always encounter a doctor in a clinic. It may be someone like myself, a family nurse practitioner, or a physician assistant, and we collaborate in North Carolina. We collaborate with a physician if need be. If there's a question that we have, or if there's something out of the norm, then we collaborate with that physician, come together and talk about the case, or what's going on with the patient, and see if we can come to a conclusion. Do we need to pass this to a specialist, or is it something that we can come up with together to make sure the patient is taken care of in a safely manner? So that's in North Carolina as of right now. We are required to have a collaborating physician. Even if you see a nurse practitioner that may own their own practice, they still are required in North Carolina to have a collaborator. And just in those instances, as I spoke of before, which isn't a bad thing, but that it is there. Some states, other states are without that collaboration, but there are some, and North Carolina is still one of the states that has it as of right now, and this is 2023. So the primary care setting is, like we like to say, like I was speaking of before, it is a clinic. It is a what, like most people say, a doctor's office, but like I said, you may not always have a doctor in there, but they have access to a doctor in North Carolina anyway. Let's see. I think that is all that I have for today about what is a nurse practitioner. It was just an introduction, because a lot of patients I encounter, they do have questions about what a nurse practitioner is. We are nurses, but we have an advanced degree, which allows us to do a little bit more than a typical nurse scope of practice. So we can do this nursing skills as well, is what we always have done, but now we have added some of what is a little bit of what the physician can do as well. So ordering medications, diagnosing, um, ordering, labs and things of that nature, we can do as nurse practitioners. And in the primary care setting, that is what we do. If you found this video to be informative for you, hit the like button and subscribe, so that way you'll be able to see more videos that I make like this. Thanks for watching, and we'll see you in the next one. The next video that I plan to make will be talking about the primary care clinic that I work in, ARS Medical Primary Care. So if you want to learn more about this clinic, please stay tuned, like and subscribe, so you'll have access or be able to be notified by hitting the bell when this video is posted. Thank you for watching, and until next time.